realize it, but colorectal cancer is the third most common cancer in the United States.
The month of March is set aside to bring awareness, and today Dr. Donald Kim with the Spectrum Health Medical Group is here to talk about risk factors as well as helping you get your questions answered. And I know Dr. Kim, several years ago, Katie Couric led a national crusade to really elevate the discussion about colon cancer awareness. What, from your standpoint, are people more educated these days?
I think they are. I think she did a great job bringing the colon cancer awareness to the forefront, and people are getting more often getting screened now. The problem is, if you look in the United States, we're still at about 50+%, so that's still a lot of people that aren't getting colon cancer screening. So segments like this is a good way to get people out there and get their colonoscopies.
Yeah, well, we hope that we are helping people out there. There are some risk factors that are things that are out of our control. What are they?
Sure, it's who your parents are, if you've got certain diseases. So obviously family history of colon cancer or polyps. If you have inflammatory bowel disease or ulcerative colitis, something like that, there's nothing you can do about that. You have that does increase your risk.
But at least you know then.
Sure, exactly.
Mm-hmm. There are also some other things that we can do to maybe start to reduce our risk of developing colon cancer.
Sure, just like your previous segment, if you're active playing pickleball or whatever, that's a good way to go. And certainly diet has an influence on it. Red meats, certain other dietary influence can affect your risk of colon cancer. So basically, eat healthy, be healthy. Also smoking. Smoking is a contributor of colon cancer as well.
Okay, so let's just face it, you may not be the doctor that people want to see because of going in for that visit and getting a colonoscopy. You know, people sometimes are scared of things like that.
Sure.
Can you walk us through? I mean, it's really not as bad as a lot of people think.
No, it's not. And if you talk to people, I think the worst part of it is the prep. It's the prep, because the prep makes you do certain things, and so those certain things allow us to do the colonoscopy. After that, it's a matter of you get sedation and you're very comfortable through that, and most of the time you don't even remember the test, so it's actually not bad.
I had a colonoscopy a few years ago. I was having some other health problems, and that was kind of one of the things that checking things off the list, and I agree with that. I was really surprised at how easy the whole process was, minimal sedation, and I understand the prep that I went through has even gotten easier in the recent years. Tell us about the benefit of a colonoscopy, because during a colonoscopy, if you see a problem, you can take action right then.
Sure, that's what, as a screening tool, colonoscopy is excellent. You find the problem, you find a polyp, and then at that time you take care of it, you remove it. Certainly there are others that may have a cancer, they can be biopsied, but the nice thing about a colonoscopy, the screening tool is also the treatment. So we can take care of it and you're done, and we say maybe you'll get a check again in 3 or 5 years.
It's pretty curable if you catch it early.
And early colon cancer is very curable, and we've done well. The cure rates are better, patients are doing better because we're catching them earlier, more people are getting colonoscopies.
Okay, what about screening kits?
Well, their screening kits are available. That's essentially a test you can do at home, and that's essentially looking for blood that you don't see with the naked eye, but you can do it on this special card. And then we have free screening kits available that you can do, and
that's really nice.
That is a screening test for colon cancer.
And you actually are trying to educate people, and you're having a great chat, an online chat where people can participate from the comfort of their own home or even from their offices.
Sure. My partner, Nadav Dahavni, he's going to be doing an online chat tonight. Actually, not tonight, today at noon, and he's going to be able to answer any questions that people have about colon cancer or anything else that they have on their mind, I guess.
There's some advantages to being a part of something like that because you're not actually leaving your home or wherever you are. Do you feel that people have a bigger comfort level with something like that, especially if they have questions about how it's going to go?
Yeah, my wife and kids really don't tell people what I do for a living and such. So essentially, when you're discreet, like even Dr. Dahavni, he doesn't have to. Well, I guess they know his name, but anyway, you can ask questions in a.
You don't see faces.
Exactly.
And you don't have to give a name.
Nope.
I mean, and so it kind of breaks down a barrier of sorts.
It's a neat tool to get some questions answered.
And so the baseline for screening is age 50. If people are sitting at home and they've been thinking about this, can they call you directly, or do they have to go through their insurance?
Certainly, typically you would go through your primary care physician. Primary care physician will make the arrangements, but based on insurance, your insurance carrier, you may be able to get a colonoscopy by yourself by calling a different office who might be interested.
Okay, and so we actually want to give your information of your office, so anyone's watching and they want to get in touch with you, beyond the online conversation that's going to be happening at noon today. Here we go. There is the address, phone number, and website. This is such really great information, and people, you know how many times I'm saying to my husband, you need to get that checked, or you need to, do that. It really can save a life.
It sure can. I mean, it's really a shame when you see someone in their 60s and they have a colon cancer, and they go, this is the first time I've done it. And you kind of in the back of your mind go, man, if he did that at 50 years old, maybe I wouldn't be having to explain all this stuff about surgery, and I'd be just saying, I just took a couple polyps out. See you in 5 years.
Yeah, it is really great. Well, thank you, Dr. Kim. Great information. And if you're sitting at home, encouraging you to call to get that appointment, because it is the best gift you can give yourself or your family member. The gift of a colonoscopy.
Yeah.
Could save your
life. It's on
life.
my list.
That's right. You're way too young for that. You're not even 40 yet. We'll be right back.
This is 8 West.